Okay, today we're going to talk about something that affects millions of women, but, we just don't really talk about it. Urinary incontinence. We're going to break down the official medical guideline to get straight to what the science says about why it happens and, more importantly, what we can do about it.
So just to give you a sense of the scale we're dealing with here, the medical guideline says that up to half, that's 1 in 2 adult women will experience this at some point in their lives. I mean, that's a staggering number. It really shows you just how incredibly common this is.
And yet, here's the thing. Even though it's so common, it stays this hidden health issue. There's this massive gap between how many women are going through it and how many people are actually talking about it.
So that brings us right into our first section, a common, hidden problem. Let's dig into just how widespread this really is, and maybe touch on why it stays in the shadows so much.
These stats really paint the picture, don't they? We're talking anywhere from a quarter to half the female population. And yeah, it gets more common with age, and it's a big factor during pregnancy, but honestly, the most important number on this slide is that last one. Only a third of women dealing with this have ever talked to a doctor about it. That means 2/3 are just trying to manage it all on their own.
Okay, next up, stress versus urgency incontinence. It turns out not all incontinence is the same, and figuring out the difference between these two is absolutely the most important first step to finding a real solution.
And this chart breaks it down perfectly. On the left, you've got stress incontinence. The easiest way to think about this is like a mechanical issue, kind of like plumbing. When there's physical pressure, you cough, sneeze, or jump, it just overwhelms the muscles that are supposed to keep everything closed. Now on the right, urgency incontinence is a totally different beast. This is more of a signaling problem. Your bladder muscle just decides to contract when it shouldn't, giving you that sudden, intense, I have to go right now feeling, even if your bladder is barely full. Knowing which camp you're in changes everything about the treatment plan.
So let's say you think you have one of these. What happens next? How do doctors actually figure this out? That brings us to section 3, how doctors find answers. And spoiler alert, it's a lot more straightforward than you probably think.
Really, the whole point of that first visit is just to get a clear picture of what's going on. Your doctor is going to be a bit of a detective. They'll ask things like, when does it happen? How often? How much is it affecting your day-to-day life? They'll also look at your medical history, and even simple lifestyle stuff, like how much coffee you drink, which can be a bladder irritant. And then there's usually a quick physical exam, just to check the strength of those really important pelvic floor muscles.
Your doctor might also ask you to become a little bit of a data scientist for a few days by keeping what's called a micti-dagboek, which is basically a peeing diary. And this isn't just busy work, I promise. By tracking what you drink, when you go, and when you have any leaks for just 3 days, you and your doctor can uncover patterns that are otherwise impossible to see. It's actually a super powerful tool for getting the diagnosis exactly right.
And now for the part we've all been waiting for, pathways to treatment. We've talked about the problem, we've figured out how to diagnose it, so let's talk solutions. Because the guideline is crystal clear on this condition is highly treatable.
All right, first up, let's look at the treatments for stress incontinence. Remember, this is the mechanical type, the one that's caused by physical pressure. So it makes sense that the solutions are all about giving the bladder and urethra better physical support.
Okay, so the first line of defense here is totally non-invasive, and wow, is it effective. Pelvic floor exercises, if you do them the right way, can completely cure about half of all cases. Then there's something called a pessary, which gives you internal support right when you need it, say during a workout. And for more severe cases, there's a minor procedure called a mid-urethral sling, where a tiny bit of tape provides support. The success rate on that is amazing. 3 out of 4 women are cured after a year.
Now, for urgency incontinence, that's the signaling problem, remember, the approach is totally different. We don't start with strengthening muscles. We start with behavioral therapy to actually retrain that faulty connection between the bladder and the brain.
Bladder training is pretty much what it sounds like. You work with a doctor or a physical therapist to create a schedule for going to the bathroom. The whole idea is to slowly, gradually increase the time between visits. You're teaching your bladder to hold more, and you're learning techniques to manage those sudden urges. You're basically taking back control so the urge doesn't control you. For a lot of women, this is all it takes. If needed, medication can be added as a second step to help calm down that overactive bladder muscle.
All right, we have covered a ton of ground. So let's just boil it all down. What are the absolute key takeaways from this entire guideline? Okay, first and foremost, and I really want this to sink in, you are not alone. This is not some personal failing, it's an incredibly common medical condition. Second, it is so treatable. The evidence is clear. There are effective solutions that cure or dramatically improve things for most women. Third, the first things to try are simple and non-invasive. We're talking exercises and training.
And finally, and this is maybe the most important point of all, just talking to your doctor is the start of everything. That one conversation is the first step to getting your life back.
And that brings us to our final question, doesn't it? We've seen the numbers, we've seen how effective the treatments are. So, if this is so common and so fixable, why on earth does it continue to be this big secret? Why are we all so quiet about it? Definitely something to think about.